Welcome everybody to the Biogen Science Enrichment Program. Today, BIPOC Neuro is partnered with Biogen, which is a biotech company based in Boston. So hello everyone, my name is Mahmoud Sadeghi. I go to Northwestern where I study CS and neuroscience, and I go by he, him pronouns.
Hello, my name is Laika Mazar. I go by she, her pronouns, and I study chemistry at Northwestern. I'm the Chief Operating Officer for BIPOC Neuro.
My name is Frida Ganiu. I as well attend Northwestern. I use she, her pronouns, and I'm the Chief Financial Officer at BIPOC Neuro.
In general, BIPOC Neuro is an organization dedicated to advocating for the representation of Black, Indigenous, and people of color within the field of neuroscience, especially women and those part of the LGBTQ plus community. So we're really excited to have you all here and to have the opportunity to hear from our speakers and to just sit down and meet and talk with us.
And I would just like to say hello. My name is Mercedes Baina. I'm a neuroscientist at Biogen. I'm so excited to be partnering with BIPOC Neuro. And essentially, this is a space where we hold for diversity in STEM. And I'll pass it on to my colleague, Jorge.
Hi all, I'm Jorge. I go by he, him, and I am a senior associate scientist at Biogen, working in the multiple sclerosis and neuro repair research unit. So I have to read a disclaimer. Although I work at Biogen, the statements and viewpoints expressed in this webinar by myself and the other presenters are our own and do not reflect the official position or views of Biogen. So a little bit about Biogen. Biogen is a biotechnology company that focuses on the discovery, development, and the delivery of therapies for the treatment of neurological diseases. So when BIPOC Neuro reached out to us, we thought it'd be a perfect fit to collaborate and get the word out about neuroscience and STEM to the next generations. So today I'm really excited to introduce you to one of our former colleagues, Isha, Mehta, and our current colleague, Cheryl, Cheney. Isha will be giving a talk titled "A Day in the Life of an Industry Epidemiologist," and Cheryl will be presenting on ensuring research animal welfare. The first talk will be given by Isha Mehta, and a little bit about her. Isha currently works as a senior manager on the pharmacoepidemiology team at Regeneron Pharmaceuticals. She received her bachelor's degree from Purdue University in brain and behavioral science and a master's of public health degree from Dartmouth College. She was previously employed as a senior manager on the epidemiology team at Biogen. Her professional interests include research involving real-world evidence, such as administrative claims and electronic health record datasets, rare disease epidemiology, and health equity research to advance and improve health outcomes among the underrepresented and underserved populations. In her personal life, Isha is an avid tennis player and reader. So now I'm going to give the floor off to Isha so she can give her talk. Thank you.
Thank you, Jorge. And do we have the slides? Maybe I was a little late in sharing my slides. Sorry, everyone. Is it easier if I present or?
I'm confused. Are these not your slides or?
I think I'm sorry, I didn't realize I had to email them to you all, so I think they might have just emailed to you like maybe 20 minutes ago. If not, I can present my slides.
Oh, okay, because I don't know. These were the slides I was just, okay, wait, I can just check again. Wait.
Yeah, if not, I have them. That's okay.
Wait, honestly, just to make it quicker, I guess if you already have your slides open, it would just be easier, I guess, for you to share. And
Yeah, absolutely. Okay, give me 1 second here. Let me just pull them up. Okay. All right. Of course, I wanted to switch. Give me 1 second. Okay, can you see my slides? Yes, no?
Yes, thank you.
Yeah, okay, I'm sorry, I can't see the Zoom screen anymore, so just give me a shout if there's any issues. But hi, everyone. My name is Isha Mehta. I am currently employed as a pharmacoepidemiologist at Regeneron Pharmaceuticals. And so, quick disclaimer: I am an employee and shareholder of the company, and the statements and viewpoints expressed today are my own and do not reflect the official position or views of Regeneron. And so, how do I get that to disappear? Whatever, that's fine. So I want to start off with asking you a question and sort of challenging what your assumptions might be. So I want you to think about, what does a scientist look like, and what tools do they use? And so, historically, scientists have been white and male, and this has gone on for a long time. But in the recent few decades and today, there have been great strides in diversifying and welcoming other groups and cultures as scientists. But there's still a lot of progress that needs to be made. And the second challenge and the second question I want to ask you all is, what tools do scientists use? Again, going back towards, what do we think scientists look like? What do they do on a day-to-day basis? Are they people that wear a lab coat? Are they people that, are using beakers and vials and different chemicals? And while that's certainly the garb and tools of some scientists, and they do very important work, there are several kinds of scientists, and many of us don't use a lab or beakers or vials. So I want to talk to you a little bit today about epidemiology, which is the field that I work in. So epidemiology is the foundation of public health. So it deals with the study of the distribution, causes, prevention, and control of acute and chronic conditions in certain populations over certain time periods. And it covers a lot of things. That statement covers a lot of things there. So basically, we seek to learn and answer why, how, and when some people contract diseases while other people do not. And so essentially, epidemiologists are public health professionals and advocates. So a good analogy is physicians or doctors or other healthcare providers work with individual patients. They work on an individual level. Whereas epidemiologists, we work with entire populations of patients. So I work with not just one patient, not just 10 patients, but sometimes hundreds of millions of patients. And due to the COVID-19 pandemic, epidemiology has become much more of a mainstream term. Before that, I used to get a lot of people who thought that had to do with skin, epidermis, epidemiology, but it doesn't. But there's still the misconception, that epidemiologists focus mainly on infectious diseases, and there are certainly those that do, and they do great work in that space. But we actually work on all types of diseases. So personally, I have worked on diseases ranging from high cholesterol to Alzheimer's disease to rare pediatric conditions. So really, really across the spectrum there. So for example, what is some of the classic work that epidemiologists are responsible for, and sort of things that we maybe take for granted these days? So one was demonstrating that long-term smoking significantly increases the risk for lung cancer. Now today, we take that as a given, but for a long time that wasn't the case. And it was through epidemiologic work that we were able to understand that. Even questions and answers relating to who's at a higher risk for developing sickle cell anemia. And we know that African Americans and people of African American descent are at a substantially higher risk. And so the research that epidemiologists do help to inform healthcare professionals about the risks that their patients face and may help to prevent serious outcomes. If we think about lung cancer and smoking, for example, doctors are now able to, or other healthcare professionals are now able to warn their patients that smoke that they're at a significantly increased risk for lung cancer. There was a time not so long ago where we couldn't do that, where we didn't know that. And we had to wait for that epidemiologic information, that long-term data, which long-term data is a gold mine for people in my profession, that allow us to give those answers. So why does industry need epidemiologists? If we're public health professionals, it seems like we should work really more in classic public health, organizations and institutions such as academia or the government. But one of industry's main goals is to develop the right drugs for the right patients. So what that means is developing drugs, devices, or other interventions that will treat, prevent, cure the condition or the disease among people who are affected or vulnerable to this condition. So we want to make something that will really have an impact on the people who are affected. So industry epidemiologists, so they can understand a whole plethora of things, including how many people have the condition. Before we set out to see how many people this will help, we want to know, just what does the landscape look like? Who are these people? What are the characteristics of these people? Is there one group that's more affected by this condition or not? That could really impact how we research this product. The risks that people with this condition face, for example, are people with this condition more likely to have another condition, or is also called a comorbid condition? Do these go hand in hand? Does one lead to another? If we're studying one condition, is another one going to influence that? These are things that we need to know. Do people with this condition have worse survival odds? Is this not only are we trying to maybe slow the progression, ease their life, but are we trying to actually lengthen their life? Are we trying to give them better quality of life? And over time, also really making sure that the drug or the intervention is safe and effective in the treated population. We want to make sure that what we're putting out there is going to be beneficial, that our benefit risk profile is going to be favorable. And very importantly, is it safe among children, among pregnant women, and especially other vulnerable groups? I mean, these are groups that we really want to look out for. These are not your typical adult populations. So my daily activities. So rather than using lab tools to answer these questions, I use tools like large electronic healthcare record databases that contain hundreds of millions of patient records. And so I think something kind of interesting that maybe people don't realize is, since when you go to the doctor, for example, or you go to see your healthcare provider, let's say, I broke my arm or something, they put that in my electronic health record, and that's an individual health record. But, across the country, this kind of information is getting collected daily, hourly, sometimes, in every minute, probably. And this is a huge, rich data source. And so this data becomes available to researchers like myself. Now, don't worry, it's completely anonymized. There is no way that I could trace it back to a single person. It's still very compliant to make sure that patients are anonymized and their privacy is protected. But it enables me to look at trends in the population over time, to see other patients with the condition and really try and understand what's happening at a population level. I also use things like national health surveys or other national health data sets that are collected by the CDC or other government or federal government or state organizations. And this can be really rich data there, and it is publicly available. You do not have to pay for this. You do have to learn a little bit of coding, but it's not that hard to do. There's a lot of information there, and anybody can sort through this and gain insights about the population or the question that they're interested in. And some of these health surveys they're conducted annually. They go back to sometimes the 1970s. I mean, think about your census data. Yes, the massive census is only done every 10 years, but some of these national health surveys are done annually, and they collect some really valuable information. And of course, scientific articles that are published by others in the field. There's a whole part of epidemiology and scientific research in general where you rely on information published by others, conducting systematic lit reviews, and you can get some really quality information that way. And so something that's really cool that I like is that all of my tools, all of my research, any of my data sets, they all sit on my computer. So wherever I go, my research goes, which allows me to work from anywhere at any time, in any time zone. And so, sometimes that means I can, if I'm really feeling like I have a research question, I feel like I want to dig into it right now. I'm thinking about it while I'm, eating dinner one night. I have the ability to sit down and be like, okay, let's just look and see what other scientific articles have been published on that. Or, does one of the national health surveys sort of, does it contain this condition? Could it be something that I could explore further? So it allows me to sort of take my research with me wherever I go, which is awesome. And so my day-to-day activities usually center around a particular research question. So for example, here, I might get asked by one of my colleagues at my company, who is more likely to develop Parkinson's disease? We're developing a new trial. We want to make sure we get the right people in our trial, the people who are going to be at the highest risk for developing Parkinson's disease. Is this a middle-aged woman of Asian descent, or is it an elderly white man? So now I do what I know how to do best. I go back to these population data sources that I have. And maybe there's some published health surveys that I can use. Maybe I have to use electronic health records or even insurance claims data. So I can use these data sources. And using these data sources, I know that people age 65 years and older are at an increased risk for developing Parkinson's disease. So that's part one of this. So we know that maybe the older person in this situation is at a higher risk for developing Parkinson's disease. And I also know that in the US, white people have a much higher occurrence of Parkinson's, or at least that's what the data suggests to me at this time. Now, of course, looking at bias and sort of that data as a whole other field and a very meaningful field to explore there too. But so far, my data suggests that older people and white people are at a much higher risk. And so given between these two choices, my best guess would be that the elderly white man is at a higher risk of developing PD compared to the middle-aged woman of Asian descent. So a little bit about how I got here. And so I wanted to pursue research, and I'll say that when I was going to school, and even up until a few years ago when epidemiology was not a mainstream word, I wasn't really sure about what I wanted to do, but I knew being in a lab was not a good fit for me, and that's okay if it's not a good fit for you. There's still tons of ways to do research, and I gave it my best effort. Wasn't for me, but I was always interested in neurology and psychology, and so I majored in brain and behavioral science. And then while I was in college, and I would really recommend this to every student, I participated in research and internship opportunities, and they ranged from internship opportunities at pharmaceutical companies to agricultural research, where I was out on a farm every single day for 3 months. So it can range, and you learn something at every point. And I would really encourage people to pursue those. And then from there, I realized I was interested in public health, and went on to receive my MPH. And then as part of my graduate education, I was required to do an internship, and that internship led me to my first job in industry. So I think if I had one piece of advice for students or for people that are interested, whether it be neurology or other types of science, I think internships, co-ops, even just shadowing are great opportunities. You can learn so much from them. You can even learn what you're not interested in. And so I think I would definitely encourage some, people to explore that. But yeah, that's just a little bit about me, a little bit about what I do. And yeah, I think feel free to contact me if you have any questions. It doesn't feel like it was that long ago that I was just a student myself, although I say that every year and it gets further and further away. But yeah, I'm happy to answer any questions that you might have. Thank you.
Thank you, Isha, for presenting. We're going to move on to the Q&A. So if anyone has questions, please type them in the chat.
So I see Mercedes' question in the chat that all the data comes to us without opt-in. So yeah, it's a little bit of a scary sort of thing, the way I phrased it. So in a sense, and this is something sort of I would encourage people to think about a little bit about where they fall on this. It doesn't come directly to, so your data is not sold directly to pharmaceutical companies. What happens is the larger healthcare network that you're in. For example, I live in North Carolina, so my healthcare network is the University of North Carolina Health Network. They make a decision to partner with a third-party organization where I have to be careful they do essentially they sell your data. Yes, they do, and it happens, and it is scrubbed. It is made sure that it is completely anonymized. They are compliant with HIPAA, and then it is then people like myself have the option to utilize this data. Now, of course, you can't just get this data and do whatever you want with it. There are entire committees to make sure that the work that you are doing is going to be beneficial. It is not going to violate, any sort of patient privacy or anything like that. And so there's a lot of checks and balances along the way, and there's no way for somebody like me to go back and say, okay, this information came from Isha, who lives in Raleigh, North Carolina. It's not possible for that to happen. If that were to happen, it would be a big problem. So yes, that data is given to people like us, but actually the US is unique in that way. In countries where they have universal healthcare, this is a given from the moment you're born. And so they have entire registers where they track all of the health data from the moment you're born to the day you die. And so the US is a little bit interesting in that if you move from healthcare organizations, they may not be able to track you over time, but in countries, I think Germany, Sweden, all of that, they have registers where they track that data over time. Okay, let me look at these questions here. Mercedes' question about, do I like to code? It's interesting. So it's actually like statistical programming. So it's a little bit different than regular coding. I wouldn't say it's quite as complex. Like versus a necessity is a different question, but like in the sense that it's nice that once you have your data set, you can answer those questions at your own pace, and they're pretty easy to check, and QC from person to person. And that's nice that there's only a handful of different sort of programming languages that people need to learn in order to do this. Okay. Great question about whether a disease is considered prevalent enough to be an epidemic. So there are different thresholds, and forgive me, I should know the numbers, but there are different thresholds that that must be met in order to be considered an epidemic or a pandemic. I think apologize, I should know the numbers off the top of my head, but it's like once you meet 100,000, diagnosed cases, it's considered this level. And then once you move up to, let's say, another 100,000, then it's an epidemic. And then you move up another one, it's a pandemic. And so there are a certain number of numbers that you have to meet in order to be considered an epidemic. And so what are the steps you take? It's entirely dependent on how they're diagnosed. And so I think in the case of infectious disease, it's actually kind of straightforward in that if they test positive for the condition, they are considered diagnosed with the condition. What would you like to see improved in your field? I think what would I like to see improved in our field in terms of how we collect population level data in the US, we are very, very behind on how this is done. There are certain variables that I believe to be crucial, such as somebody's race, their ethnicity, their sexual orientation, their gender identity, that our race and ethnicity are not accurately collected in the US in these large data sets. I'm thinking of a couple of insurance claims data sets. You can either pick a race or an ethnicity, you cannot pick both. And this is an issue that is industry-wide in the health insurance industry. Other ones are based on race and ethnicity categories that were set 25 years ago. They have not been updated since then, and anything to do with gender identity or sexual orientation is not asked at all. So, we are, at this point, it's very difficult for people like me, as much as we might want to understand how these conditions affect different groups of different sexual orientations and gender identities. We're not able to, we're reliant on diagnostic codes, and those are very problematic because there's some bias there. For example, where I'm basing it on somebody putting in somebody's medical record a diagnostic code saying that they have gender dysmorphia or whatever, which we fundamentally don't agree with, and so we can't do any research there. And so I think the US is very behind on this. The insurance industry is very behind on this. So I think we would really like to see that improved. To epidemiology, the most important things to consider. I mean, I think I would start with epidemiology is a core thenet of public health, but I would also encourage you to explore the other aspects of public health. There's community health, there's people who look at social determinants. Well, actually, if we're talking about epidemiology is sort of the general term. You can even go further into it. Some people are very interested in, you might want to think about what kind of diseases or conditions you're interested in. Maybe you're really interested in oncology and cancer. There's cancer epidemiology, and that's a very, very complicated field, and they do great work. Infectious disease, we see the value of infectious disease epidemiology. That's something that you could be interested. Social epidemiology is really cool. That's personally where my interest lies. What are some of these trends we're seeing by different groups? What are things like socioeconomic status? How does that impact things? Education, housing, and so important things you should consider. I mean, I think epidemiology is great. It's general. You do have to like math a little bit. There is a lot of statistics in it. You don't have to necessarily love it, but it is something to consider there. But it does serve as the foundation there. But from there, you can sort of go in a whole bunch of other directions.
Thank you, Isha. We're gonna save the questions for later, just so our other speaker has time.
Yeah,
So thank you so much.
Yeah.
We will be moving on. Frida, do you have the slides ready?
Awesome. So Now we're going to move on to the presentation by Cheryl Cheney. A little bit about her. Cheryl enrolled in the University of Rhode Island's zoology degree program with the ultimate intention of figuring out how to communicate with dolphins, but eventually deciding that wildlife conservation and ecology was a more practical focus. She enjoyed an intro to philosophy course so much that she then chose to double major, to consider human-animal relations from a different angle. She then pursued museum studies out of curiosity for the power of objects and places to inspire and teach people. Cheryl then began her Ayaka career at MIT in 2005 and hopped Broadway to Biogen in 2014. Prior to this, she participated in field research on bullfrogs and endangered seabirds and lab research involving bats and squirrel monkeys. Although the bulk of this activity required IACUC approval, the seabirds, they were in New Zealand with different rules, and it wasn't until she was consulting the literature to learn more about squirrel monkeys' needs that she discovered the existence of IACUCs and was intrigued by the role in ensuring humane and compliant animal research and transitioned to this career path. Now I'm happy to pass it off to Cheryl for her talk. Cheryl, you're muted.
Thank you, Jorge. So, hi all. I am Cheryl Cheney, as Jorge said, and I'm the IACUC coordinator and compliance specialist for Biogen, which means that I work for Biogen's Institutional Animal Care and Use Committee, which is what IACUC stands for. And I help this group guide the scientists at Biogen on the animal welfare regulations and how to follow them. Next slide, please. So it is my pleasure and privilege to present to you today, What's IACUCing? The regulatory recipe for research animal welfare. Next slide. So we'll first consider what makes an organism an animal and why it's important to ensure their well-being. Then I'll go into what an IACUC is and what they do. And I'll conclude by summarizing what are the basic expectations for researchers who study animals. Next slide. The animal kingdom is but one branch on the tree of life. It does not include bacteria, single-celled organisms, fungi, or plants, even if some of them do resemble animals. Next slide. But the animal kingdom does still include a wide variety of organisms, some of which conversely resemble plants. But all the organisms in, back one. All the organisms in the animal kingdom are multicellular, so they have more than one cell in their bodies, and their cells are bound by membranes instead of walls, so they're more blobby than cuboid. And they have to get their nourishment from eating complex organic materials. Like plants can just absorb their energy from the sun, animals need to eat. And all animals are assumed to have a common ancestor and are therefore related to varying degrees. It might surprise you to learn that not all animals have brains or even neural tissue. It's a very inclusive kingdom. And humans are a very unique type of animal. And one of the things that sets us apart from other animals is our development and use of the scientific method for understanding the world around us and within us. Other animals are sometimes the subjects of our scientific studies, and that can be because we are either curious about the animals themselves, or we are exploiting our similarities to and commonalities with animals to conduct experiments that we wouldn't be allowed to do on our fellow humans because the laws in place to protect them would prohibit us from doing so. But I'd like to assure you that since the mid-1960s, there have also been laws in place to protect animals used in research. Those laws, however, do define animals rather narrowly. The Public Health Service policy for the care and use of laboratory animals, which institutions have to follow if they're receiving grants from agencies like the NIH, the FDA, or the CDC to pay for their animal research, applies to vertebrate animals only, which are the species groups at the bottom of this slide. Next slide, please. Oh, previous slide, please. And the Animal Welfare Act, which applies to any institution in the United States that is using species as it defines as animals, only covers birds and mammals, and not even all birds and mammals. Mice, rats, and birds that are bred in labs instead of being caught in the wild are also excluded from the Animal Welfare Act definition of animal. However, they used to be included between 1970 and 2002, and it's always possible that they could be re-included in the future. Next slide, please. Together, the Animal Welfare Act and the Public Health Service policy establish the federal restrictions and requirements when animals are used for research. If an institution or organization is not following these rules, they face the risk of various penalties, which range from written warnings to fines, or for serious or recurring infractions, they could even lose their right to use research animals altogether. Next slide, please. In addition to the legal responsibilities that direct scientists to attend to animal welfare, there are also ethical considerations. Each animal values its own life. You might hear my dog in the background valuing hers. Animals have things that they like and things that they don't like, and things that they seek, like reward and pleasure, and things they seek to avoid, like fear and punishment. And when they are in our care, we have a responsibility to honor this and prevent them from suffering unnecessarily. And one of the ways we can do that is by applying the 3 R's of replacement, reduction, and refinement. These were formulated in 1959 by William Russell and Rex Birch, and instruct that animals should not be used for research if there's any other way to get the answers. And if animals are needed for a study, they should be animals as low on the evolutionary tree as possible. And no more than the absolute minimum necessary should be used, and the least painful procedures possible should be used. Next slide, please. Apart from obeying the law and acknowledging that animals have feelings, it's also best for the science if animals are well taken care of. If they're not, their physiology, their internal biology can go haywire and get unpredictable, which adds extra variables or unknown factors to a study. And in scientific endeavors, you always want to minimize the number of unknowns so that you can gain more confidence in the conclusions that are drawn from the results. So when a research animal's needs are understood and met, the study results are more likely to be reliable and reproducible, and therefore more trust can be placed in their predictive power. Next slide, please. IACUCs, or again, institutional animal care and use committees, are required by the Animal Welfare Act and Public Health Service policy. If an institution is using animals for research as defined in those documents, then that institution has to assemble a group of people, whether that's a college, a company, a hospital, or some other type of organization. And these people are assigned to oversee the animal research to ensure that the legal, ethical, and scientific obligations are all being appropriately addressed. The regulations require a diversity of individuals to be represented on the IACUC. The Animal Welfare Act, which covers fewer species, also requires less representation than the PHS policy. So the PHS policy adds a few more types of people. So a veterinarian needs to be on an IACUC, whenever any vertebrate animals are used. The veterinarian is expected to be knowledgeable about animal needs and how to meet them. But each institution has to have someone from the community that has no other ties to the organization so that they can have an independent opinion that represents society at large. They're not concerned about whether the company is going to get the profits or whether the faculty member is going to get tenure. It's all about, will this study help society in some way? The non-scientist on the IACUC helps to ensure that the average citizen can understand what will be happening to animals at the institution and why. It can be someone like a clergy member or a lawyer or an insurance agent, whatever, as long as they haven't pursued a science degree or taken a science job. And then the scientist on the IACUC is expected to be experienced with the realities and hurdles of animal experimentation to help set the expectations for their fellow IACUC members in that regard. And an IACUC is free to have multiple representatives for one or more of the categories. So multiple scientists, multiple community members, but they can also have additional members that don't neatly fit into any of the required categories, such as a safety expert who's a scientist, but not a scientist familiar with lab animal research necessarily. Next slide, please. So the IACUC helps to ensure the institution can retain and fulfill its animal research privileges by helping the animal users to understand the regulatory requirements. They typically do this by creating policies and guidelines as references. These are documents that ideally are a lot easier to read and understand than the laws themselves. They review scientists' animal research proposals, and I'll go into more detail on this on the next slide. The IACUC checks in on a periodic basis after animal studies start to determine whether the activities are going as approved and planned. And every 6 months, they have to double check whether all players in the program, including themselves, are doing their part and complying with the regulations. And also they check in on the conditions, what the conditions are like in the facilities where the animals are being housed and used. And when things go wrong, like someone not following the approved protocol or animals suffering unexpectedly, the IACUC then helps to figure out how to get things back on track and ensure the best care is provided for the animals going forward. Next slide, please. So before scientists can do any animal research, they have to prepare a proposal called a protocol that includes several key components. They submit that protocol to the IACUC, who then determine whether it can be approved or if it needs to be modified before it can be approved. They also have the option to disapprove it outright. The point of the process is for the IACUC to ensure that the proposed use of animals is going to be compliant, humane, and meaningful. That means the protocol should make it clear what the scientist hopes to find out by doing this research. Based on what the scientist wrote in the protocol, the IACUC is determining whether this research is clearly relevant to human or animal health, the advancement of knowledge, or the good of society. And the protocol also needs to make it clear what each animal will undergo from start to finish, from their arrival at the institution all the way to the end of the experiment. The scientist also needs to convince the Ayakuk that this animal is the best species to help them answer their questions. So the Ayakuk wants to see that they've considered, like, could a mouse be used instead of a monkey, or could flies be used instead of fish? And in addition to the explanation of why the scientist chose a particular species, the Ayakuk is looking to see whether the scientist clearly explained and justified the number of animals they're asking for. So the scientist will typically describe how many different groups they need per study, so how many different variables are they testing, and then how many animals they need per each of those groups in order for the data to be of value. And then they also need to explain how did they come up with those numbers. And this part is very important. They need to identify the steps or stages in the experiment that might cause pain or distress to the animal, and what they will do to minimize it. Things like using anesthesia, so the animal is not even conscious when painful things are done to it, or analgesia, so that after something painful has been done, they're receiving painkillers so that they don't feel that pain. The scientist also needs to indicate who's going to be doing these things to the animals, and do they have the necessary knowledge and ability to do it competently with minimal error and causing the least harm. The scientist also has to document that they reviewed the literature, which means other scientists published studies, or consulted with subject matter experts to determine that this research hasn't already been done before, so they're not unnecessarily duplicating animal use. And they also need to indicate how the chosen methods are optimal for the research goals. Explain that this is the best chance for successful and beneficial outcomes, and that this has been balanced with the least chance of harm to the animals. If the Ayakuk has any questions or concerns, the scientist is asked to address them. And a protocol can go through multiple reviews and rewrites before the Ayakuk is finally ready to approve it. And they often ask scientists to improve the protocol for things like clarity. Everything needs to be easily understood. Consistency, so there's no confusion about what will be done. Compliance, to ensure that the rules and regulations are going to be obeyed. And or the animal care plans to make sure that the scientist will be treating their animals properly. Then if the scientist needs to change anything about the study after the Ayakuk has approved it, such as using different types of animals or different quantities or different techniques or adding new people, then they need to modify their protocol and resubmit it to the Ayakuk. This is called an amendment. And the Ayakuk needs to review and approve that amendment, again ensuring all of the aforementioned details are properly in place before the scientists can move forward with their new plan. Next slide, please. So after the Ayakuk bestows their approval, it's then up to the people working with the research animals to do the right things, which are kind of summarized very succinctly on this slide. And I hope you found this little taste of the Ayakuk recipe interesting and informative. And I'm glad I was able to share all of this with you, because I did not become aware of the existence of Ayakuks until nearly 10 years after I was first involved in studies using species covered by the Animal Welfare Act and Public Health Service Policy. And I don't want that to happen to you. But thank you. Next slide. And I'll be happy to take your questions. I'll just open the chat.
Thank you so much for speaking. Yes, like the screen says, we will move on to our Q&A. So if anyone has any questions, please drop them in the chat.
Oh, that's a good question, Jorge. Choosing the unaffiliated individual that comes from the community. So typically we ask people on the Ayakuk if they know of anyone that might want to serve that role. So it's a matter of networking usually. Although sometimes, like, Biogen has 2 community members on their IACUC, and one was there when I started working at Biogen, so I'm not sure how we got her on board. But the other individual was referred to us. She indicates she was serving on another IACUC and said she was interested in serving on others, so they put her in touch with us. But yeah, it can be one of the hardest things for an IACUC is finding a good community representative. What standards are used to determine whether animals used for research are being used properly? So the Animal Welfare Act and the Public Health Service Policy each have some very general requirements, like cause the least amount of pain necessary, use the fewest amount of animals necessary. But there's also a book called The Guide for the Care and Use of Laboratory Animals. And both of the federal agencies have endorsed using this guide for an animal research program. And that guide, it's like 200 or so pages. It's put together by veterinarians and animal facility managers and scientists based on their experience of what are the ways to keep animals as comfortable as possible, how to maintain facilities for cleanliness and comfort, what to provide the animals, like different, how many can be in a cage, what sort of food and bedding should be provided. So there are resources out there that institutions do refer to. So the penalties vary. And the infractions can vary too. Like there could be something like, oh, you did not complete this by this date. And that's, it's important, but it's minor, and that might just be a written warning. But if you're doing something like you forgot to have the IACUC review activities before you did them, like that's very serious. And that could mean like that scientist is no longer allowed to work with animals at that institution. But in between, there can be fines, and those will increase as the types of infractions get more serious or last for longer periods. I don't know if you've kept up in the news recently, but there's a company called Envigo who breeds or bred beagles for research, and they had several violations, recurrent violations of poor animal care noted by the USDA, which is the agency responsible for following up on the Animal Welfare Act. And they've had to cease their breeding activities on beagles and adopt those animals out. So, and in addition to penalties, there's also the repercussions of damaged reputation for that institution or institutions that don't follow the rules. I have not personally had any confrontations with animal rights activists, and I don't think we have at Biogen either. Although in conversations with people, sometimes when I share what I do, someone who's been smiling and speaking with me positively suddenly is like, I've got to go. So, what I try to do in that situation is explain to them that I don't think it's great to study animals in place of humans, but we have so many life-saving disease cures or treatments that would just not be possible without the use of animals. Like, I don't think I would be here today. And maybe several of you would not be here today without prior animal research generating the data needed to figure out how to keep us healthy. So yeah, it's tough. There are, there are public relation departments at institutions usually that will help manage, and security will help manage any animal rights activities. But it's always something complicated to deal with when it arises.
All right, thank you for answering the questions that we have. We want to be respectful of everyone's time. So we're gonna wrap up the webinar. In the chat, you will see a survey link for those that attended to fill out and just review our speakers, our content, our structure of the webinar. And we'd really appreciate if you fill it out, because those who do fill it out will be entered into a giveaway to receive some Biogen or BIPOC Neuro merch. And this link will also be sent out through email as well as with a link to the recording for this and our past webinars.